According to Marlene Cooper and Joanne Lesser in the book Clinical Social Work Practice, cognitive theory is based on the concept that there is a reciprocal interaction between what one thinks, how one feels, and how one behaves. Cognitive theory stands out as evidence-based practice, and according to Social Work Policy Institute, evidence-based practice is a process in which the practitioner combines well-researched interventions with clinical experience and ethics and client preferences and culture to guide and inform the delivery of treatments and services. And many of the empirical studies of cognitive theory have been with depression, anxiety, phobias, social anxiety, post-traumatic stress disorder, obsessive-compulsive disorder, bipolar disorder, and substance abuse. Cognitive theory refers to the organization of information in the mind to create a depiction of the external world. There are times when this information can be distorted due to the development of schemas early in life. Schemas stem from attained knowledge from past experiences, which affect processing and categorization of present information. Schemas can produce maladaptive thinking patterns and distorted core beliefs. A schema from childhood may be dormant for a number of years, but then an external situation that resembles the same past hardship can trigger it, which can negatively affect the interpretation of the new information. According to Herbert and Foreman, schemas also contribute to automatic thoughts, which are unconscious thoughts that run through an individual's mind. Automatic thoughts pertain to oneself, the world, and the future. This is referred to as the cognitive triad. These thoughts have direct impact on feelings and behaviors. Therefore, a destructive automatic thought may create a distorted reality, which affects an individual's behavior negatively. According to Beck's model, there are different types of cognitive errors. Arbitrary inferences is when an individual draws a conclusion that's contrary to the evidence or without having enough evidence. Selective abstraction refers to focusing on one detail taken out of context instead of considering the whole picture. Generalization is when an individual takes the outcome of one single incident and applies it to every situation. Magnification is putting great significance on one negative event. Personalization is relating a negative event to oneself when there is no evidence, and dichotomous thinking is viewed things as all or nothing. According to Herbert and Foreman, cognitive therapy is based on cognitive theory, and the main focus is to alter beliefs and create more adaptive ways of perceiving reality. This form of therapy encourages clients to treat a thought as a hypothesis, so instead of a fact. This allows them to view the thought more objectively and test the validity of it by exploring evidence. Cognitive therapy involves collaboration between a client and patient and is goal-oriented. The main focus is for the client to see thoughts, emotions, and behaviors that are interconnected. Identifying negative automatic thoughts is integral in order to replace them with more evidence-based information that depict a more balanced reality. Practice settings. Social workers can incorporate cognitive theory in a variety of practice settings. These settings include places like hospitals, nursing homes, schools, counseling, parenting classes, amongst other locations. For this project, the practice setting that will be examined is the educational setting. Example social worker working in educational setting with a group of children who are being bullied or who are the bullies. They would engage through explanation of services, discussion of decision-making in being a bully. They could do an assessment through using surveys to grasp the deeper understanding of the kids' thinking patterns about bullying, using Socratic questioning in an open and explorative interview style to examine kids' thinking patterns about bullying. And they could use goal setting by setting goals with the children, for example, identifying core beliefs about bullying and using tools to give children new ways of thinking. Social workers would intervene through using curriculum to teach children how to identify, confront, and replace illogical and unhelpful thinking patterns regarding bullying and replace them with new ways of thinking about conflict. They would terminate services through reflecting on new thinking patterns concerning bullying, and social workers would conduct an evaluation through giving children post surveys.
Strengths. Cognitive theory works well for all ages and a variety of client populations. It is easy to use, and it is one of the most researched theories. In addition, it has been proven to effectively treat a variety of disorders. Limitations. As a microtheory that pays specific attention to the individual and the most direct influences in the individual's life, cognitive theory does not necessarily consider the person and environment perspective, which promotes the understanding of how the environment affects the individual and how the individual impacts the environment. Therefore, this theory is not as helpful for meso or macro social workers. Also, since this theory addresses changing one's thoughts, this theory can assign too much authority to the social worker. If not used correctly, a social worker could perpetuate the negative experiences of groups who have experienced colonization and have been required to adopt the norms of the dominant culture. Because of the potential misuse of this theory, social workers must pay close attention to adhere to social work values, such as self-determination, especially when treating underprivileged members of society. Furthermore, this theory has a strong individualistic emphasis, which could be a problem for cultures that value interdependence.